Alright, MRCP candidates, let's talk about the head injury and the CT scan within 1 hour and within 8 hours. So within 1 hour, we'll be depicting this gentleman who is banging his head against the wall, and you can see that he's a kid in between 13 to 15-year-old. Whereas for the CT within 8 hours, we will be depicting that with a elderly gentleman. So since this young boy is in between 13 to 15 years of age, so you can see here he's banging his head against the wall, and as a result he is getting a slight bit of splashes over here. So on the initial, so what are the CT scan that you need to do within 1 hour? The first indication is GCS of less than 13 or 13 on the initial assessment, or the GCS of less than 15 2 hours post injury. That is the first indication. The other one is seizure at the time of assessment, or if there is a depressed skull fracture. Then if there is any signs of basal skull fracture, which will be depicted by the panda eyes, or there is blackiness post tympanic membrane, or there is CSF leakage. The next one is if there are two or more than two episodes of vomiting post injury, and you can see that this gentleman cannot lift his hand up to control his vomiting, and this will depict the focal neurological deficit. So these are your findings. If any one of these are present, you need to do a CT scan within 1 hour of the injury. GCS of 13 or less than 13 at the initial assessment, GCS of less than 15 after 2 hours of the injury, any depressed skull fracture, any seizures, any signs of basal skull fracture, or vomiting two or more than two episodes of vomiting, and the focal neurological deficit. So these are the CT scan within 1 hour. Now let's talk about the CT scan within 8 hours. So the first indication is you can see this grandpa has fallen down off the stairs. So if there is a dangerous mechanism of injury, which includes if a person has been hit by a car, or someone like a cyclist has been hit by a car and like flown and then hit his head, that is one of the indication. Or you can see that this grandpa has fallen for about 5 set of stairs, which is about 1 meter in height. So if such a dangerous mechanism of injury is there, or if the gentleman is above 65 years of age, as is depicted by our old grandpa. So anyone who is above 65 is a geriatric patient, and usually seen by the elderly medicine team. So those needs to be, if they have any damage or any bang to the head, they need to be scanned within 8 hours. The next one, you can see our grandpa has forgotten anything, so this should remind you of a retrograde amnesia for about 30 minutes of all the events that has recently happened. So if it stays for more than 30 minutes, you do need to scan them. You can see the low plates, the plates are broken on the ground, so it should depict the low platelets or any coagulopathy, especially the people working in hematology. So you will have loads of these patients who will have low platelets, or if there is any disruption in the coagulation profile, such as the patient working, the people working in the hepatology ward. So in these cases, you need to scan these patients. So within 8 hours. To scan the patients within 8 hours, you have the indications of a dangerous mechanism of injury, retrograde amnesia of greater than 30 minutes, age greater than 65, low platelets, or any coagulopathy. So thank you very much. That would be the indications.